This is a picture that I took in a maternity ward in India not too long ago. You can see the beds here. These are sacks of rice. People have brought goods to be able to trade for the services of having delivery of their children. In India, about 75% of births still occur at home or attended only by a midwife. It's rare to bring them to the hospital. And one of the reasons why is because these hospitals are not yet equipped to the level that we would expect here in Canada, certainly, or anywhere that I've ever lived. We can't seem to crack the problem of making progress fast enough. What I did as I was preparing for today was I looked online for current estimates of how much the world spends on health. Now, this is an estimate that comes from the World Trade Organization, and it's actually 6 years old. It's what's on the website right now. I put the link here for you, but it's actually a 10-year-old estimate. It's $6.5 trillion here. Today, we spend about $10.5 trillion. This is according to some consultancies and think tanks that publish a number. The World Bank says it's maybe about 7.4 trillion, maybe a little less than that. We don't really know is the answer, but it's a lot. It's expensive. Our healthcare system is expensive. It's also unequal. This is an estimate from the World Bank of how much is spent in the United States this year, $9,403 per person per year, almost $10,000 per person per year on healthcare, and in Eritrea, $25, and the lowest number associated with Madagascar at $14 per year. So the takeaways so far, it's expensive. We spend about 10% of world income on healthcare. It's getting more expensive. Per person spending in countries like ours, Canada, the United States, and Switzerland is going up about 10% in the last 6 years, and it's unequal. 84% of healthcare around the world is spent, the healthcare budget is spent in OECD countries, wealthier countries here. What if we spent the same amount as we spent in Switzerland, which has nominally the best healthcare system? Certainly the most is spent there, $9,674 per year. What if we spent that same amount in the United States, in Canada, in Eritrea, in Madagascar, everywhere in the world? Could we afford it? Could we afford that? Here. So to do this thought experiment, I just looked up the number of people on the planet. We have 7.4 billion, and I multiplied it out, and it comes out to $72 trillion here. Now, to get some sense of how affordable that is, I also looked up this morning current gross world income. Okay, so here's what I'd like to ask you to imagine. Let's imagine that all of us, together with the Chan Zuckerbergs and the Bill Gates and everybody, took all our income for a single year and devoted it to this problem, to paying for healthcare for everyone so that we could get everyone an equal level of healthcare, and that was really good quality care, like what's available in Switzerland. How much would it cost? It would cost $72 trillion. But how much money would we have if we pooled all the money that we made in a single year? World income now is $73 trillion. We can't afford it. In fact, we can't really even afford our own healthcare system in our own countries right now. This is unsustainable even for us in a place like Canada. It's unfair and it has to be fixed. And my best answer to what we need to do is to think differently. Thinking differently, it seems like that's too small. That's too small a thing. It's too easy to change. But I want to argue here that by thinking differently about what we're doing, that we can actually get to a better answer here. I would like to ask you, if you would, to please raise your hand if you feel you're healthy. Oh my gosh, I think actually everybody in the room has raised their hands. That's wonderful. That's fantastic. Here's the World Health Organization's definition of health. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Complete mental and social well-being. That means no eyeglasses, no bruises, no cuts, no no concerns, really. No stress, no worries, no neurosis. How many of you would be healthy by this definition? One person, you raised your hand in the back, but sir, forgive me for saying so, but you're wearing eyeglasses, and eyeglasses would make you unhealthy by this definition. So please put your hand down. This is what we're trying to achieve, I think, at least through our health, as we rush into this is where we go. What can we preserve from this definition? This definition is not a very good definition. It's not very useful. It's the definition that the World Health Organization adopted in 1948. But there are elements to this that I want to ask you to keep in mind as we go forward. Well-being is important. The absence of disease is important. But we need to do better. We need to understand better what we're trying to achieve. Here's an alternative definition that was developed by my friend Alex with a series of co-authors. And by the way, it came from Wikipedia, so it has to be right. It says, health is the ability of individuals or communities to adapt and self-manage. So this idea that you have control over what's happening to you. It's the ability to adapt and self-manage when facing physical, mental, or social challenges. And when Alex talks about this now, he talks about resilience, the ability to bounce back. In fact, I also wear eyeglasses, and my glasses broke at the temple this morning, but I still feel healthy. In other words, I still have enough resilience that I feel healthy. In fact, this morning I actually have a cold, but I still would have raised my hand. I would have said that I feel healthy because I feel like I have the ability to deal with it, And that's what this definition is offering us, health as the ability to adapt. And we need to understand that better. That's the first thing that we need to do to improve the healthcare and health of the poor and even of ourselves. We have to focus on health and not healthcare. We can't afford to propagate our system, not at the level at which it's operating right now. It's too expensive. It's getting more expensive. It's not delivering the health outcomes that we always want, as we heard this morning. And it's not fair. So we have to do better. And the first thing that I want to say we have to do is to focus on health and not healthcare. So let's turn now to some other opportunities that are on the table that are sitting right before us right now, where we can make a difference. This is a chart that shows the causes of death for everybody, the young and the old. About 12% of global deaths, more or less, maybe about 10%, 12%, are from injuries. And injuries predominantly affect the young here. We can do better with injuries. Let me just move forward for a moment talking about injuries. I'll come back to the other bars on this chart in just a moment here. Injuries are car accidents. This last year, tremendous increase in drug overdoses, war, suicides, homicides, drownings, falls, burnings, and poisoning. I'd like to ask you to think, for example, first about car accidents in a place like Canada or the United States, where car accidents certainly are common, but not nearly as common in places of poverty. Our roads, our system of transportation was designed on ideas and principles that were developed decades ago. The roads in Toronto and in most major cities were in place years ago. In fact, in some instances, even before we had tarmac, even before we had paving on the roadways. In many of these places of poverty, there is no established road system that is robust. In other words, you can change the roads around. Why can't we do better than what we have here in a place like Toronto, Greater Toronto, in designing a road system that will be safer, that will lead to fewer car accidents? We know we can do better with 2016 technology and design than was available 50, 60, 70 years ago when many of the roads that we traveled this morning to get here were designed. Let's do better than the system that we have now, not try to export the system that we have now that is too expensive and that we can't afford. In other words, we can both improve the quality of outcomes, improve health, and reduce our costs at the same time by doing better. I would argue about suicides and homicides. I'm involved right now in a large project on firearm control, what we can do to better understand how firearm misuse could be prevented by coming up with a better approach. There's a lot we could do with artificial intelligence, machine learning, with big data, with the tools that are available to us today to try to analyze where pockets of risk are and to intervene where patients are most vulnerable to prevent injuries. So this gets me to my second recommendation for what we can do to dramatically improve health in places of poverty and then benefit from that here, to design new systems to prevent injuries. So the bottom set of bars here represent communicable, maternal, perinatal, and nutritional conditions here. And these primarily afflict the young, under 45 years of age. 63% of deaths from these conditions are among the young, only 11% among the old. Let me show you what this means in English. On the right-hand side, communicable, maternal, perinatal, and nutritional conditions, malaria, tuberculosis, HIV, and other infections. Infections lead the list here. Communicable diseases means that they're transmitted person to person. A lot of conditions around childbirth, both for the mother and for the child, and nutritional deficiencies. Food systems are inadequate here. That's what's in this column. About 40% of global deaths, a little less, 38, 40% is the estimate, come from these conditions. These are entirely preventable. By preventing transmission of malaria or tuberculosis, not only among ourselves, but in the case of malaria, of course, from mosquitoes, we can completely elevate and improve health. Now, this is where our healthcare system is actually strongest. This is where the system that we have in Canada and the United States and Switzerland actually performs pretty well. About 15% of our healthcare bill in a place like Canada is spent on healthcare for the young, and we do quite a good job compared to some of the other areas, and in particular, healthcare for the old, which I'll talk about in conclusion. So this area is where we can do better. We have to reduce the costs. A couple of years ago, I did a study on the average cost of an incubator, a neonatal incubator here in Toronto, and it's many thousands of dollars. One model was $37,000. We know we can get incubators, neonatal incubators for newborn babies for way less than that in places of poverty. We can get them for $100, less than that are almost as effective as what we have here. We need to radically reduce the cost of all this stuff that we need in order to be able to do a good job here. But this is the place where we can intervene right away by improving and aggressively disseminating healthcare for the young. And of course, many organizations are doing this. We've got to do more, though. Finally, this middle set of bars, non-communicable diseases. These mainly afflict the old, people like me and older. In fact, an estimated 83% of our healthcare budget in Canada is spent on people who are over 65 years of age, 83% here. This is where our healthcare system is wildly broken. The diseases that are in this category, there's quite a lot of them, but the main ones, most of us, unfortunately, are going to die of cardiovascular disease, heart attacks, or cancers. Respiratory diseases like asthma are also on the list, but the really predominant causes of death in our setting is cardiovascular disease and cancer, and it's wildly expensive. It's unaffordably and unsustainably expensive, and it's not the best health care that we can do. There's a book here that by Atul Gawande called Being Mortal that I'm happy to lend to anyone who wants to read it. This is a great book. I was transformed by this book. What Gawande does in this book is he talks about how our healthcare system will drive families and elders to spend tremendous amounts of money for a 10% chance of extending their lives a little bit without realizing that they have a 90% chance of shortening their lives by doing the procedure here. In other words, our healthcare system is really broken in terms of the way that that we deal with elder care. Most elders die alone or without the attention they need in hospital or in assisted living facilities or nursing homes here. Now, compare that with the system for elder care in indigenous communities. Elders are in the center of communities in many indigenous cultures. They're integrated, they're judges, they're counselors, they have wisdom, they're surrounded by. We have to go into settings of poverty if we want to make a difference and improve health and learn about how to take care of our elders by keeping them in the center of their communities. We have to learn how to both make our healthcare system more effective and less expensive by providing people with tools to self-manage, to adapt, to be resilient. I would love it if this room a few years from now were filled with elders, and when I asked the question, "Are you healthy?" they all raise their hands here. So this leads me to my final point. The big opportunity in global health is to support elders in their communities and to bring those insights back to our system here in Canada and in Switzerland and in the United States. All right, let me conclude. If we do these 4 things, improve our systems while tending to the poor, here, focus on health, not healthcare, design new systems to prevent injuries, lower the costs, improve and aggressively disseminate healthcare for the young, and support our elders better, we can unlock the human potential, not just of half the world's population that's living in poverty, but of ourselves as well. Thank you very much.